seen physicians who have gone through the program and then apply the practices that they've learned on their own
Yeah.
practice.
Yeah.
You've seen their practice transform truly into the outcomes that the patients are receiving, the referrals that they're getting, and the more people coming in their door saying, hey, I heard that you're the best at this.
Correct. And so like, I remember just speaking with June, she was a physician assistant, I think ear, nose, and throat. She was saying how doctors in her practice now were sending some of their, in an ear, nose, and throat practice, their vertigo patients, their dizziness patients that were impossible to solve. They're like, oh, maybe June needs to take a look at her hormones. Like, oh my God, like this is sacrilegious. Hormones have something to do with someone's vertigo. It's really cool. We have medical providers who've gone through our program. They tell me even during the program, they're like, in my medical group alone now, I have developed the skills and the reputation of being able to solve these difficult to treat problems. I've become a mentor to some of the other people. So I love, like, I want everyone out there to know these are your healthcare providers. There is a percentage of them that get it. And they want to know how they can learn to do this and how they can help. And what's so different about how we do it, our clients know this, is I teach skills. Yeah. I'm teaching skills. I'm not sitting here with a slide presentation only and be like, oh my gosh, we have 3.5 days to teach you all of these things and no hands-on, no personal experience. I want every single provider going through our certification to experience the programs, number one. Number two, to get direct education and mentorship from me and our instructor team on how to teach and deliver these programs and education to your patients. I am giving providers the tools with which they can say, you know what, maybe I want to apply this to my one-on-one patient practice, or maybe I want to become somebody who's able to teach through social media or online programs to reach more and more people, not just in my geographical location, but everywhere, right? So there are providers who are like, I want to think about maybe taking my practice online or starting a program like Dr. Maggie has with Transform, where I'm teaching patients skills. How would that transform a practice and a physician's life when he or she becomes a teacher and a mentor to themselves, to their patients, and to other practitioners?
But can any physician that wants to take part also enroll from anywhere in the world?
In fact, I have more physicians, just as many physicians reaching out from other countries as I do in the United States. And part of it for me is I'm beyond borders. When I am an educator and I'm a teacher, when a physician becomes a teacher, then we become crossing global lines. We cross geographical boundaries when we become teachers, because can I work with a client in England on teaching them about thyroid? Can I work with a client in Zimbabwe with POTS where they have no access to doctors who even know how to diagnose it or treat it? Can I teach this client skills?
Check, yes.
Yes. So the answer to my own physician burnout was to teach. When I realized that I could use an online platform, social media platform, to really sharpen my skills and build my skills as a teacher, then suddenly that transformed my world and my life. And it transformed patient outcomes.
And then it brought you back to why you were in this in the first place, to help people. You were back to really helping people.
Yeah. The more I became a teacher and really owned that identity and invested my time, energy, and focus, because I got training everywhere. I mean, over the last 27 years, I've been trained by the most wonderful, acupuncturists, chiropractors, naturopaths, and medical doctors. And this is how, over the years, I've been able to do that. I have had some really good mentors and teachers who taught me in their very areas of specialty. And now I love the fact that I've been able to use it to deliver a comprehensive functional medicine model to patients, but also to providers who want to learn how I do this. Education is the answer to some of the limitations that we see in our medical practice, even some of the country and cultural aspects of care. Let's move beyond borders. Let's utilize and hone our role and our education as teachers, and we can cross geographic lines and also change how we practice, whether it's one-to-one, or how about one-to-many? Yeah. Like, how many people have I been able to impact in this video alone, right? this one time, this last, 40 minutes of my time, how many people are going to be seeing this video? How many people are you going to share this with? And anybody, if this resonates with you, in the comment section, tag somebody you know that really need to hear this. How many physicians do you know that went into this for all the right reasons, right? And are stuck in a system for all the wrong reasons, right? And really want to weigh out, and they don't even know that what functional medicine is. They may not even know what a certification is. And number 3, they certainly don't know what functional medicine instructor certification is about, and they need to, right? I would love for you guys to share this through Facebook or YouTube. I would love for you guys to share this because we need an answer to physician burnout. We as physicians are just as mad and just as sick and just as frustrated as you are with the lack of answers to chronic disease and our own physician burnout. We are working in a system we feel like we're a slave to. We are clocking in and clocking out, and we have to bill you an extra visit after 15 minutes because this is the system you guys and insurance companies and hospital system have determined how physicians should be compensated. We are a victim in that system as well. So for me, I got out of it. I had to jump out of it. I teach now. And I impact hundreds of thousands of people every single year. And we teach physicians how to impact hundreds of thousands of people every year of their lives.
So why not, if you are a physician out there who is feeling some of these same stressors, who is feeling the extreme amount of burnout, or you know somebody who's in the medical field who's also feeling this sounds like, why not check this out and understand ways out of it, a way to get out of the burnout, a way to be a teacher, a way to transform your practice in some way, shape, or form, whether it's continuing the same traditional seeing patients or moving to an online platform, which sounds like something you address during the 6 months that you get to spend with these practitioners.
Absolutely. And people ask me, what kind of providers do you think would be great to become instructors in functional medicine? And I'm going to say definitely MDs, definitely nurse practitioners, definitely naturopathic physicians, chiropractors. I have functional nutritionists reaching out to us with that. There's a variety of different types of providers that could really benefit from this kind of training. But your goal needs to be, I want to become a damn good teacher of this. So it's a functional medicine instructor training program, and it's a certification for that. So it's very specific and unique. I'm pulling back the curtain. I'm teaching my secret sauce for how I teach. That's the key that's been so missing, I think, from functional medicine training is the better you are at being a teacher and an instructor, the more your career and practice options really open up, and the bigger the impact that you have on your clients.